Imagine a cancer that can survive chemotherapy, return after treatment, and then somehow convince your own immune cells not to attack it. That is part of the challenge with ovarian clear cell carcinoma, but researchers are finding that this difficult cancer may have an unexpected vulnerability: the immune system itself. Ovarian cancer isn't one single disease. One less common subtype is called ovarian clear cell carcinoma, or OCCC. Under a microscope, many of its cancer cells have a clear-looking interior, giving the disease its name. But what really concerns doctors isn't its appearance, it's its behavior. When this cancer becomes advanced or returns after treatment, it can be particularly difficult to control. And compared with some other ovarian cancers, it may respond poorly to conventional chemotherapy. So researchers have been looking for another way in. Your immune system is not designed only to fight viruses and bacteria. Specialized immune cells called T cells can also recognize abnormal cells, including cancer cells. Once activated, a T cell can directly attack and destroy a tumor cell. So why doesn't the immune system simply eliminate every cancer? Because tumors have developed ways of applying brakes to the immune response. And two of those brakes are especially important: PD-1 and CTLA-4. Think of T cells as powerful cars equipped with multiple safety brakes. Those brakes normally protect healthy tissue from excessive immune attacks, but tumors can exploit the same system. When checkpoint pathways are activated, T cells can become less effective at attacking the cancer. Immunotherapy tries to interfere with this trick. One drug used in the study, nivolumab, blocks the PD-1 checkpoint. Another, ipilimumab, blocks CTLA-4. Instead of attacking the cancer directly, these drugs attempt to release two different immune brakes. Researchers tested this combination in a phase 2 study involving 32 people with clear cell gynecologic cancers. 19 had ovarian clear cell cancer. The others had clear cell cancers originating in the endometrium or cervix. These patients had already received between 1 and 8 previous treatments. And overall, the response rate was modest. Only a minority of patients experienced major tumor shrinkage. But then, researchers saw something remarkable. 2 patients with ovarian clear cell cancer experienced a complete response. That means their measurable tumors disappeared on imaging, and these weren't brief responses. At the time the results were reported, both complete responses had continued for more than 3 years. Other patients also experienced prolonged disease control. That tells researchers something important. This treatment certainly doesn't work for everyone, but in a subset of patients, the immune response can be remarkably durable. And this creates the biggest scientific mystery. Why do some clear cell tumors respond while others barely respond at all? The answer may involve the tumor's mutations, the number and location of immune cells inside it, the proteins the cancer displays, and the entire environment surrounding the tumor. Clear cell ovarian cancers can have molecular characteristics that differ from other ovarian cancer subtypes. Researchers are now searching for biomarkers that might identify the patients most likely to benefit before treatment even begins. But releasing the immune system's brakes comes with a risk. The same immune activation that attacks cancer can sometimes damage normal organs. In this small trial, about 22% of participants stopped treatment because of toxicity. Checkpoint inhibitors can cause serious immune-related side effects involving organs such as the intestines, liver, lungs, skin, and hormone-producing glands. So stronger immune activity isn't automatically better. It has to be controlled. So has immunotherapy solved ovarian clear cell cancer? No. Most patients in this study did not experience dramatic tumor shrinkage. And this was a small phase 2 trial, not proof that dual immunotherapy should work for every patient. But those unusually long complete responses reveal something valuable. Even a cancer that can be difficult to treat with chemotherapy may still contain an immune vulnerability. The next challenge isn't simply creating stronger immunotherapy, it's discovering which tumor will respond before treatment begins. Because the future of cancer medicine may not be about finding one treatment for every patient. It may be about finding the right weakness in each individual tumor. Follow BioFacts for more discoveries changing what we know about cancer and the human body.